feel worthless even more. I feel like I'm a walking disease bank. And people avoid you already, but now they're avoiding you even tenfold.
That's Paul. He's 43. He's been homeless for 7 years, ever since he hurt his back and lost his job. Paul is one of nearly 8,000 homeless people in Toronto who live in shelters. He used to consider himself lucky to have a bed, but now with COVID-19, he's not so sure.
What's the situation inside the shelter?
It's dire. Tensions are high. Guys are upset. And it's understandable. Like everyone else would be too. When you're trying to stay away from the coronavirus and you can't.
That's because inside the shelter, it's almost impossible to self-isolate. Imagine 60 men all sleeping next to each other in bunk beds.
If the guy next to you is sick, he's going to cough on you immediately because you're 2 feet from his head. That's why bugs go around shelters so fast, because the beds are so close together and there's no space to hide from it, period.
Paul tells me his only chance at self-isolation is to walk the streets. But because of the virus, that's challenging too.
There's nowhere to go, absolutely nowhere. You're kicked out of every place you go to. Not just because you're homeless, but because of the pandemic that's going on.
You're kind of in an impossible situation.
It's past impossible situation. It's an inevitable coronavirus situation is what it is.
A few homeless people in Toronto have tested positive for COVID-19, and others await results. The city now plans to house people in hotels and other places to try to stop the spread. Roxy Danielson is a nurse in a health clinic for the homeless.
What's being done?
Right now we have assessment centers set up around the city, so if somebody's showing symptoms of COVID-19, they will go to an assessment center, and from there, if they do get tested for COVID-19, that person will go to an isolation center to await the test results.
What's at stake?
Their lives are definitely at stake. I have cried a few times at the thought of the virus spreading and killing many homeless people. I work with so many homeless people, and just the thought of people dying from this because, again, they don't have access to a safe place to live is really heartbreaking.
To make matters worse for Paul and all homeless people, the places they used to rely on, the soup kitchens, the churches, are all now closed.
What do you worry about?
Well, getting sick. Who doesn't? And then me, I do have friends and family. Like, if I get sick, I'm not going to be able to go near them, period. And I don't want to give it to them.
Homeless people were already in a tough spot before the virus. Now Paul is stuck between a shelter full of people or walking alone in the cold and hoping for the best. Nick Purdon, CBC News, Toronto.